Shock is inadequate cardiac output that results in the failure of your cardiovascular system to meet the metabolic demands of the body. So what's happening here is in shock, there's some reason that you are not getting the blood flow, the oxygen, the demands met in your body, and this causes it to go into shock. So what happens when we're not getting oxygen and nutrients essentially in failure of cardiac output is we have membrane dysfunction on the cells, abnormal metabolism, and can start causing cell death, and even eventually, as we have a lot of extensive cell death, your own death. So we will look at shock, that inadequate cardiac output from our cardiovascular system, in 4 different categories, and that is hypovolemic shock, cardiogenic shock, vascular shock, and obstructive shock. So looking at each one of them, we'll look at some examples. These are all going to be examples of hypovolemic shock. And if we break down that word, hypovolemic means low blood volume. Low blood volume may be due to a lot of water loss. It may be due to hemorrhaging. So an internal aortic aneurysm, if we look up what an aortic aneurysm is, some of those you might want to do, this is going to be a rupturing of that aorta, which loses a lot of internal blood flow. Shark attack that tears major arteries in the thigh, and we have extensive hemorrhaging. If you pass out in a hot sauna, this may mean that you have lost a lot of fluid and water as you were sweating. Someone infected by Vibrio cholera, which is characterized by rice water diarrhea. And the big thing that characterizes cholera, people just have to stay hydrated because you would also lose a lot of water with blood volume. So all of these are due to low blood volume that causes an inadequate cardiac output, inadequate blood flow to meet the needs of the body cells. So these are all cardiogenic shock. They are resultant from some kind of error, some kind of problem with the heart itself and its pumping ability to pump blood adequately through the body. And that's the failure in this case. So remember, shock is always an inadequate cardiac output to meet the needs of the body. But in hypovolemic, it's due to a low blood volume. In cardiogenic, this may be due to an error of the heart itself. Myocardial ischemia, this is before myocardial infarction, which is a heart attack. So this may be the heart is having some issues due to a blockage, electrical issues that is causing it not to work as efficiently as a pump. Same thing with myocardial infarction. Ventricular fibrillation are rapid, uncoordinated heartbeats that do not pump blood. Also, even excessive afterload. If there's severe coronary artery disease, and your heart is having to work very hard to in its pumps to overcome that excessive afterload or increased high blood pressure, this will eventually cause things like congestive heart failure, which will affect its ability to pump blood efficiently. Vascular shock, a lot of people will confuse with hypovolemic shock. Remember, hypovolemic shock is inadequate amount of fluid. This is due to low blood volume. Vascular shock is inappropriate vasodilation. And remember, you have to have, we talk about resistance almost as being a bad thing, but we have to have the right amount of resistance and pressure to have blood flow, because blood flows from a high to a low pressure. So inappropriate vasodilation, this many times is due to reactions, will cause vascular shock. So there's 3 subtypes you may want to jot down here. The first one is anaphylactic shock here, and that is someone who has a severe allergy response due to a peanut allergy. That might cause an overall systemic vasodilation as your body overreacts to that as hypersensitivity. Neural shock is also a type of this vascular shock. This would be damage to the medulla oblongata or the cardiovascular center that's affecting the whole process there. And septic shock is a big one. This is a leading cause of death in emergency rooms or trauma centers, but this is where gram-negative bacteria released from the large intestine. And in my example here, I said due to appendix rupture. It might be due to other types of things, of course, that would cause septic shock or sepsis, where gram-negative bacteria might get into the bloodstream, including even overheating sometimes. But this is due to the body's responsiveness to bacterial cell walls, and that can cause an inappropriate vasodilation. So all of those are vascular shock. And then finally, obstructive shock. There is something obstructing blood flow. Your body is not aware. It just knows that there are areas that are not getting adequate cardiac output. So pulmonary embolism, this is a blood clot in the little vessels, the pulmonary capillaries at the lung. Pulmonary embolism can block blood flow from getting the oxygen and returning back to the heart as it needs. Cardiac tamponade, this is going to be something that is putting pressure on the heart from the pericardium and causing pressure. A lot of people confuse that with a cardiac shock or cardiogenic shock, but it's not really the heart itself. It's something putting pressure there on the heart that is obstructing blood flow or obstructing the heart from working as it should. Aortic dissection, this is not an aortic aneurysm, but this is when the inside of the aorta has damage to it that will cause it to be difficult for blood to flow the way that it should be. So it is obstructing blood flow there in the aorta. And tension pneumothorax. Sometimes there is a collapsed lung that can put pressure and obstruct the heart from working well as well. And again, that's due to an obstruction, not necessarily cardiogenic shock, because it's not a failure of the heart itself. So those are the types of shock. Now, maybe one of the most important things is all of these are different types of shock. They differ in their origination, but they all actually have the same result. You have a failure of an adequate cardiac output to go to the body system. So the responses will be similar. Your body is going to try to increase the cardiac output by first increasing the blood volume. So the hormones that do that, we're going to activate the renin-angiotensin-aldosterone system, which is increasing vasoconstriction. Aldosterone is causing the sodium and water retention from the kidneys. Similar an antidiuretic hormone, we're going to increase the thirst response, increase fluid reabsorption from the kidneys and hold more water in. We're going to increase epinephrine and norepinephrine release from the adrenal medulla and cause more vasoconstriction. And we're going to even have autoregulation. Your organs are going to release autoregulating chemicals that are going to locally vasodilate vessels going to certain organs. And we can see in this chart a lot of those responses to shock. So when we have decreased blood volume and pressure, the kidneys and heart may notice this first, those bar receptors that have that decreased pressure. We're going to put into place releasing ADH from the posterior pituitary, renin from the kidneys that puts in place that renin-angiotensin-aldosterone system. We're going to increase stimulation to the cardiovascular center and the medulla oblongata, which is going to increase heart rate and vasomotor stimulation to the blood vessels, increasing resistance and cardiac output. We're increasing blood volume by releasing aldosterone and antidiuretic hormone. When we increase blood volume, resistance, and cardiac output, then we are going to increase blood pressure. So you may want to kind of slow that down and map it through yourself and walk through it. Symptoms of shock are going to be clammy, cool, pale skin. Clammy means kind of sweaty, because when we're releasing more epinephrine and norepinephrine in a sympathetic response, one of your sympathetic nervous system responses is an increase in sweat. The skin is going to be pale and cool because we have a failure of the cardiovascular system to meet the demands of the body. So we're not adequately getting blood, but we have lots of sympathetic stimulation making sweaty skin. Tachycardia and a weak rapid pulse. The heart rate is going to increase. Of course, as a result of this, we are increasing stimulation to the heart from the cardiac accelerator nerves when we increase stimulation to the cardiovascular center in the medulla oblongata. So we've got a really high heart rate, but it's weak if we don't have good blood volume. Hypotension, we've obviously got low blood pressure here, especially if we've got something like hypovolemic shock due to low blood volume. An altered mental status may be as a result of getting adequate cardiac output to the brain. Decreased urinary output and thirst, because we are releasing chemicals like aldosterone and ADH, which are retaining water, and ADH is triggering thirst in the hypothalamus. And acidosis, and we will get to acidosis and what that is later on, but if we have low amounts of oxygen, then we may be also producing more hydrogen ions. Also, we're looking at in situations where we're not getting a lot of oxygen, we are producing a whole lot of lactic acid in order to make ATP, because this is all about making ATP to supply our energy demands. If we don't have oxygen getting to certain areas, then we're making a lot of acid.